Federal enrollment reports. Washington is second only to California in a number of our residents in Washington Apple Health, which is the expanded Medicaid program. Now, many of these enrollees, we got to understand, these are people who have been uninsured for years, if not decades. These are our friends, they're our neighbors, people like Michelle and John and Carrie, whose stories you have heard. So I'm pleased to report that as of January 23rd, more than 160,000 lower-income adults were newly covered by Washington Apple Health. And more than 45,000 children have been brought into the Apple Health Care program. So that's good for Washington working families. It's good for Washington's economy. And by the way, you know, we're having a challenge figuring out how we improve the education of our kids. And we've got to find a way to finance the education of our kids. As you know, the Supreme Court has said we're about $5 billion short in providing for the education of our kids. I think it's great that we have gone forward in providing for the health care of our kids, not backwards, because it's very difficult to educate a homeless, hungry, or sick child. This is an educational issue to make sure our kids have health care. So I'm very excited about our progress in this regard. Right? And this is a fiscal step forward for us because it's saved an estimated $280 million and added, think about this, we are adding over 10,000 jobs to the state of Washington, many in rural, smaller counties where the largest employer is the healthcare industry. These are spreading jobs across the state of Washington. So we'll see even more as people use their new insurance to get regular doctor visits, preventative treatment, so we can keep people out of the emergency room. So I want to take a moment to acknowledge the hard work of our healthcare authority and the thousands of outreach and enrollment workers around the state who've made Washington Apple Health such a success. We hit our January 1st enrollment targets, and we've already exceeded our April 1st goals. Along with the people who have purchased private plans in Washington, more than 270,000 are newly enrolled in these health insurance plans. We ought to be proud of this. This is something for Washington State to be proud of. I think it's kind of cool that the Washington Post singled out, a newspaper now owned by our friend Jeff Bezos, singled out Washington as the place who knew how to do health care reform the right way. We ought to be proud of this in the state of Washington. So now our outreach and enrollment efforts continue. Thousands of people are getting covered each day in this great state. This is great progress. We're pleased how we're doing. But we know getting coverage is only the first step to bringing more affordable, accessible health care to everyone. So I want to thank everyone. I want to ask, is there anyone here who has personally helped people get coverage? Is there someone here? Could you come up here? Could you introduce yourself? What is your name? Vanessa, what do you do to work on this?
Well, I have taken time off of work to go and talk to small business owners and families in the cafeteria of the hospital that I work in.
Where's that? What hospital?
Harborview.
So Venetra Petricelli has taken time of her personal time to talk to small business people and people about how to get people signed up. Now, I think that's great. Now, every day, the governor of the state of Washington gives the Washingtonian of the Day award. And it's symbolized by this Washington Apple pin. So today's Washingtonian of the Day is Vanessa Petricelli for her great work. I don't want to have any injuries here. Okay, round of applause for Vanessa. Congratulations, guys. Keep working.